Okay, so hello everyone. On the third part of our class, I will share the screen. Maybe you have some questions to what I was explaining about the gestational diabetes, the lipidemia or macrosomia. So all of these conditions are related to the problems with the shift of utilization of glucose and lipid usage. I will talk about it now more, a little bit to explain you more. Everything is clear?
At the moment, yes. We will see later.
Okay, so that's great. That's great. So I will use some slides which were presented during the webinar on the 8th of May. Not everything will be presented today, but if you are more interested in the metabolic changes, I refer you to this recording which we have on our website. So now I will share the screen again. Okay. So let's go to the slides here and okay, so I will be speaking about higher intensity exercise during pregnancy. As I mentioned, we started the project, it was FemFit Mama. We started the project with the standard exercise intensity. It was from moderate to vigorous, around 60 to 80% of their generally, okay? Generally, so it is a standard recommendation. And what we have today, more and more people are interested what's going on in the body when we exceed these typical guidelines. So I refer you to two papers. One is by Melanie Heyman and the team. So it was a very, very good scoping review. I don't remember how many countries they finally involved, but they were really a lot of studies, even published not in English. Okay, so it is sometimes a barrier for us that we are using only English version papers because we can understand it, but they included a lot of papers which are in native languages as well. And it is a very good study, so you have the source of information. And this is from my PhD student. It was actually a repetition of what we've done before, but it was focused on high intensity exercise. So she had this idea. So this is the work that she published with her new supervisors from Poznan University of Physical Education. And of course, I was participating in that, just giving her some advice, but it was her idea to perform this scoping review in terms of higher intensity exercise. And what we've done before my current project, so Hit Mama project, it was together with our team, with Rita and also other partners. We conducted a systematic review, what was available in terms of HIT protocols. And we didn't find a lot on that time. Now, more and more studies are being published, so we have much more evidence, but on that time we found only 12, actually 9 studies and also 3 clinical trial registration. And why I'm so much interested in high intensity interval training, it's getting on popularity. Sometimes it is a little bit lower, sometimes it's on higher place. You can see the fitness trends for 2025. So for this year, published last year, and or in the beginning of this year, I don't remember, but still you can see that many people are interested in high intensity interval training, including women who are in the reproductive age. And when they get pregnant, they would like to continue their exercise regime. So we have a lot of definition on HIIT, a variety of protocols. So it can be really very intensive. let me check. I'm not sure if you see the green thing. It is sometimes very intensive, and sometimes it is not so intensive. So we can use vigorous intensity like 70-90% of heart rate max. And it will be like 14, 16 on the 6 to 20 Borg's RPE scale. And sometimes it's very intensive. So I would rather recommend the high intensity interval training to those who were accustomed to such intensity before getting pregnant, because it's really demanding. But for most women who were even inactive before pregnancy, you can use that protocols. So maybe not for these people who are completely doing nothing, but those who are, I can say, healthy, not active person, they can still benefit from that one. Of course, it is relative intensity. So relative, that means that they will feel intensity in that moment, which is maybe not very intensive for a very active person. It is relative. So how I feel now. So for me, it will be doing 3 squats, for example. It will go, I'm very tired. It is very intensive exercise. For some very trained person, it will be just the warm up. Okay, so we try to find the balance and to try to find the limit when they feel the discomfort of intensity. And usually moderate intensity means that they can exercise with the feeling of breathing comfort. So they still can conversate, they still can sing. So that means this is moderate intensity exercise. But if they feel that they are losing the comfort, that they cannot breathe sufficiently, so that means that usually they exceeded the anaerobic threshold, and we would like to have this anaerobic intensity for at least a few moments during our session. And the characteristics of interval training is that after the short bouts of exercise, you have time for rest. It can be passive rest, but we usually treat the rest as a moment to have some stretching exercises, to have some breathing exercises, to have some birth position, so preparation for birth exercises. So it's, I would say it's like 30-40% of their maximum capacity. And what next? If we can use this kind of protocol for pregnant women, now I can say yes, it is very comfortable for many of them. First, it was proven by researchers who did a lot of research in animal models. You can see here some examples that the HIT program modified some of the genes associated with oxidative stress in fetal livers and hearts. So this is the confirmation that high intensity, but not high intensity, generally exercise can impact the organs of the babies. So oxidative stress is not a good condition for any organ. We don't want too much oxidative stress. The body has to have some self-protection mechanism to deal with oxidative stress, and of course it is a stimulus from the exercise that we make some not nice for the body conditions, but because of that it is sometimes toxic for the body, but because of that the body is starting to self-defend and have some protective mechanisms, and these protective mechanisms which are developed during fetal life, so during the prenatal life when the baby is developing, the baby is born with some kind of mechanism to defend the baby and the infant and the adult later in life. So we start the self-defending mechanism, self-protecting mechanisms already here. And these researchers observed that in livers and in hearts, so very important organs for cardiovascular health and also for metabolic health, and it was started through HIT. And another paper, other papers from the same research group, they observed how how it was working in terms of cardioprotective mechanisms, and how we can use it to have better health in the next generation. So these outcomes were also very interesting. It was another research group, but still in animal models. We have some papers and the acute response. So acute, that means that it was researched immediately after one session. Okay, so acute response means that this is now. So I have a session, and now after the session, I immediately checking my body reaction. And long-term effect or chronic effect means that we are assessing the outcomes after 6, 8 weeks or 6 months, 12 months. So of course, the long-term outcomes are much more informative and are important. Still, they can be masked by other factors. So a lot of things can happen. So it's not so easy to have clear long-term outcomes, but still, if we have acute response analysis, we can say, okay, so one time it was beneficial or it was harmful, and then we can decide if we can continue or not, or what to change. So this this research group started to assess glycemic response to acute high-intensity interval training versus moderate intensity continuous exercise during pregnancy. And glycemic response was very interesting because there were some myths, there were some hypotheses, but not justified, not confirmed, that when the mother is working very hard, when she's exercising very intensively, she can use all glucose she has in the body because the muscles are using much more glucose to work. And she's using too much glucose, and the baby will have too little glucose for himself or herself. So the mother is using too much glucose, and also the same was in relation to oxygen, that the mother needs more energy, so she needs more oxygen, and therefore the baby can be not oxygenated enough, not enough oxygen will go to the baby during the intensive exercise, and it was the hypothesis. And therefore, for many years, high intensity was not recommended for the mother and or general pregnant population. Sorry, I need to drink. I have some throat problem. Okay. So from the study, we could see that an acute bout of heat exercise is well tolerated by both mother and fetus. So first, the mother felt very well, and first of all, fetus was observed through some ultrasonographic assessment, and in both studies we observed the same. And from our study, we wanted to see the changes, first of all, in the cardiorespiratory system. We had these sessions. You can see the intensity here. Red color means that the intensity was above anaerobic threshold. So the intensity where we are not using oxygen, we are using some processes, anaerobic processes, to use the energy. And it was not for a long time. So as you can see, it was a few minutes spent during the session, the entire session, but the orange color also is quite intensive. It is something between the aerobic and anaerobic threshold, but still you can see it was much more time spent here. So I could say that 15 minutes generally during the session was quite intensive. And here we have lower intensity exercises, so body posture correction, and also some resistant exercising with low load to exercise for balance, to exercise for proper gait pattern, to relax the muscles, to stretch the muscles, to have some breathing preparation, birth preparation, and breathing exercise. So this is the structure that we had for 8 weeks. You can see here we have 8 weeks. At the beginning, it was 7 minutes of warm-up. And before and after this 8 weeks of 3-weekly sessions, we had the assessment, many assessments we done. So this is again the definition that I provided for you to be aware that sometimes we don't need to have really very high intensity to call the program HIT. Okay, so this is the definition that was published. And it was the structure of our program. We started with 30 seconds of intervals, of workout intervals, and the break was quite long. So it was ratio 1:2. Okay, so 30 seconds for exercise, 60 seconds for break. And then the proportions were changed. So you can see here, it was 30 seconds of workout, but still here we had break, but 15 seconds. So very short. And this is just the example. So you cannot treat it that it must be always like that. So you have thousands of protocols. You can change the numbers of sets. You can change the numbers of repetitions. We had always 4 exercises in 4 sets, and the proportion of time were changing like that. But this is just the example. We are going to repeat it to have the same stimulus for future projects, but still it is just the example. But you have it also in the book, in the Springer book. More information you can find there. And it is something that I usually underline. We observe no effects, negative effects on the obstetric and neonatal outcomes. That means that neither the mother nor the babies were negatively affected by this kind of activity. So we wanted to assess how they were feeling. So these are the mothers and their babies after HIT sessions, and they felt very well. The babies were healthy. And this is a, let me check timing, how much time I have left. So I will not play that one because it's around 10 or 15 minutes, but it is very nice a video animation about classification of hypertensive disorder of pregnancy, because it is differently classified. But for today, I would like you to understand what is gestational hypertension. So hypertension generally is the problem with blood pressure. So the pressure is too high. And when this problem appears for the first time during pregnancy, we call it gestational hypertension. That is related to many factors. So the blood pressure is very high, and it can be it can reflect the problems of cardiovascular system. Okay, so the wrong reaction of vascular to dilate or to contract in proper moment. When we have too high blood pressure, there's a higher risk of having stroke, of having heart attack. And in pregnancy, there's a problem with blood circulation also in the direction to placenta, and therefore the circulation between the mother and the baby is disturbed, and therefore it is usually related to the risk of so-called preeclampsia, and the mother and the baby are at risk of death through preeclampsia. And usually preeclampsia is related to high pressure and proteins, proteinuria. So we have some proteins in urine, and that means that the kidneys are not working sufficiently. So this is the proteins in urine are the indicator that the kidneys don't work properly. So you have more information here. This is, as I mentioned, nice video to understand this condition. But what I wanted to show is the outcomes from our study. Here we have the blood pressure. So usually 100 110. It is good. This is good for the systolic blood pressure. So when the vessels, when the vessels are contracted, and also diastolic blood pressure, not vascular. I don't know the proper English term. I forgot. But the circulation is not disturbed through the blood pressure. So usually we have the values 110 to 70, 80 for the diastolic blood pressure. And we are a little bit worried when the number here is elevated to like 130, 140. So this is an alarming, maybe not very dangerous, but we must be careful with these numbers. If it's higher, it can be even 170, 180. So this is really very alarming. So what you can see here, that we maintain the same good numbers, the same good level of blood pressure through heat. We could observe much better decrease through educational group. Educational group, I didn't say that. We had women who were exercising 3 times a week, performing HIIT sessions, but we also had educational group which was attending educational classes. We explained why physical activity was important for them, what were the recommendations on that time, that they were supposed to exercise at least 150 minutes per week with moderate to vigorous intensity. So we explained what kind of exercises they could do. So we encouraged them to be active, but they didn't exercise with us. So still, they were women who were active. So it was not that this group was not exercising at all, but I could say they were normally exercising. Of course, normally, this is not maybe good phrase, but in line with the standards. And the HIIT group was exercising in line with our new protocol. So these women maintain blood pressure. These women even improved a little bit, but still all these numbers, all these levels of blood pressure, systolic blood pressure, were very, very good. And what we observed here for diastolic blood pressure, the higher improvement was observed here for HIIT group, and also the educational group improved a little bit. So on these graphs, it looks that the decrease was very substantial. It was statistically substantial, but generally in terms of clinical values, I could just say that they maintain normal blood pressure, because these, differences like 73, 70, so this is actually not very substantial in clinical point of view. So I would rather say that they maintain normal blood pressure throughout the experiment in both groups. So the experimental women and the comparative women. But also we had a smaller study inside the study about, so it was about the blood pressure. So we are not worried that through very intensive exercise, we can have some harms related to high blood pressure, because in fact, in high intensity exercise, during the session, the blood pressure goes up and then it is dropping down. But also in the smaller study inside that HIIT Mama project, we assessed a very nice biomarker, which is placental growth factor. And it is a very important factor that supports the development of placenta. And it has so-called pro-angiogenic, so maybe it is a difficult word for, especially in English, but that means that new vessels are created, are developed, and it is important to increase the process. And for pregnancy, the PLGF is crucial. You can see on this graph here that we have level of PLGF in normal pregnancy, it's growing from the very, very beginning. When we come back to the animation, I was talking about the implementation phase. So when the egg is fertilized and very small and it's implanted in the tissue of the uterus. So during this process, the PLGF is growing because it's responsible that in the place where the embryo is connected to the mother, so some cells are developing into placenta. And in the placenta, you must have a lot of vessels that will transport nutrients, that will transport oxygen, and will take the carbon dioxide from the baby, and will take some products of metabolism from the baby to the mother to let these products be utilized in other processes. And what we have here, the PLGF is increasing, and it's around 30 weeks of gestation when it's starting to fall down. But this is a normal situation, that when the pregnancy is in normal condition, the level of PLGF is higher than in the condition of the mother that she's going to develop preeclampsia. So the condition which is very dangerous for both. That is the main reason of maternal and fetal death throughout the world. It's not that only preeclampsia is dangerous, for example, in low-income countries or in low-educated people. It is the main cause of death throughout the world, and it's really, really not related to the medical service. It's more related to first of all lifestyle, diet, and also some genetic I can say conditions. But what we want to observe is how we can impact preeclampsia prophylaxis, and how we can cause that this level will be higher for the preeclamptic women. For now, we don't have too much data on that. Only I would like you to know that maybe these numbers are very difficult to remember, and you don't have to remember them, but please have a look how it is growing. So when we check this, okay, so this is the week 15, 19, and it is growing, and then it is falling from week 13. So usually we look at the number, which is 50% of the checked populations. And also we had a nice, I can say, presentation in relation to this PLGF during one of our conference. So what I want you to remember, that through high intensity interval training, we managed to improve the level of PLGF. Again, it was not statistically significant, but the group was rather small. It was not 30 women, it was like 17, because we had to have exactly the same week of gestation here. So some of these women were excluded to have exactly the same week to start the assessment. And in both groups, the marker was increased. So that means that the production of the vessels in placenta probably was enhanced better in the HEAT group. We must repeat these outcomes in bigger group, but still it was sufficient to say, first of all, it is not true that we can take too much oxygen during intensive sessions from the mother. And second, it is important to understand that actually we can help the mother to support the baby with the oxygen. And here are some outcomes from HEAT Mama. Again, we have the irisine assessment. So irisine, I was explaining what is the role of this biomarker, but I would like also to say that many authors observed that irisine must be elevated during pregnancy to regulate gestational diabetes, to regulate the lipid metabolism. But what we observe important is how much irisin the mother must produce after a single session, but generally they don't need too much irisin throughout the pregnancy. So the production is stimulated, but generally the exercise is doing so much that they don't need too much hormones like this throughout the pregnancy. We also observed some very interesting outcomes related to insulin. You can see here that insulin increased in high intensity interval training, and it was a substantial increase. And why it was increased here? So sometimes the insulin increase, the increase of insulin is considered not to be very beneficial, because that means that there is too high insulin resistance. But we didn't observe these problems in our study group. So we thought that maybe the insulin stimulated muscle blood flow, and that the muscles, the body, the mass of the muscles was improved. And actually, we observed that in our other study. You can see here, it is important sometimes for the mothers who don't want to, who do not want to take too much kilograms on them throughout pregnancy. They want to be still fit. And we say, okay, you must have some kilograms during pregnancy because the baby is heavy and the uterus is heavy, and you must have some extra kilograms. And here we have the proof that, of course, the body mass is increasing, and it is crucial. The baby must increase, the body must, the weight of the body must increase. But still, the fat-free mass is better impacted by high-intensity interval training. So the mother had lower fat, and she had higher muscle mass. So this is important for them to understand that sometimes the changes will be very beneficial for them in terms of body weight. So maybe I will skip this very complicated graphs, but this one I will keep for you. So again, we have placenta. I was presenting it many times. So we have placenta, we have maternal vessels. Okay, so these are small vessels, and these vessels are connected with umbilical vessels, and through this umbilical cord, everything goes to the baby. And we have the red color, so nutrients and oxygen go to the baby, waste and carbon dioxide from the baby, all right? And increased glucose transport to the fetus caused by greater efficiency of fetoplacental blood exchange and better glucose utilization by the fetus due to intense maternal exercise. So what we found that we have higher insulin, and high level of insulin is transporting more glucose through these vessels. So this was one thing, that we had more insulin to transport glucose. We had more PLGF to stimulate more vessels here. So generally, the fetoplacental circulation could be improved through heat. And this was one of our conclusions. These are also some confirmation of that, and we observed, so not we, the other researchers confirmed actually this hypothesis in their previous research, that we had some transporters of glucose in exercising participants. So I've is that, and also the last one I would like to explain you. The last biomarker is leptin. Leptin, it's usually considered, again, similarly as insulin. If you have too high leptin, it is not a very nice situation. That means you have some problem with lipid utilization. We observed increase level of leptin, but we didn't observe problems with the lipid storage. So they were not fatter. They had better condition, free fat mass was higher. That means that probably the muscles were developed and they had lower percentage of fat mass here. So actually the lipid level, the leptin level was not related to increased fat storage. And it doesn't mean that we could cause some harm in terms of lipid profile. It was rather related to, again, insulin sensitivity, increase of glucose uptake, and oxidation in skeletal muscles. So this may be a rather messy graph, but you can see that leptin is related in many, many processes, especially at the beginning of the placentation. So we have some kind of processes from formation. So formation, that means that after the egg is fertilized, we have the implantation process, and then there is the processes related to placenta development, angiogenesis, so when the vessels are developed, and again, how the baby is developing. So leptin is taking part in all these processes. So it doesn't mean that when we have too much leptin, it is only about fat storage, that the mother is getting bigger. The leptin is responsible for regulating the processes. Of course, there are optimal levels, so we should not be so happy in all the cases. And this is also the key factor in terms of infertility for many women. So optimal levels are crucial, but still we should enhance the reproductive function of leptin through proper combination of other biomarkers in these processes. So I will skip that one. It's about, let me go. It's about resisting. I will not go through this very detailed things. So I hope that I didn't make too much confusion in your head about the metabolism, but I wanted to present you maybe a little bit more scientific approach to that, why it can be helpful. And the last part will be about pelvic floor muscles. So we have 30 minutes, not 30 minutes, 20 minutes left. So I will go quickly through pelvic floor muscles, but maybe you have any questions about metabolism changes. No? Okay, so the last part is related to pelvic floor. This is the structure of pelvic floor muscles. From a few years, I started to underline that men also has pelvic floor. I have one question here. Is there a possibility to get the presentation PDF? Yes, you will have this presentation afterwards, and also the recording. This is male pelvic floor, this is the female pelvic floor, and both must be exercised. When we have exercises for pelvic floor, this is a very nice graph. When we have rest, you can see that pelvic floor is a quite nice support for the pelvic organs. We have this is coccyx, so the last bone of the backbone, the spine, and here is pubic bone, and this is a hammock, and all the pelvic organs, including very heavy uterus. Here is a vagina, and here we have very heavy uterus. So all the organs are here, so they have some support from pelvic floor. And when we have intra-abdominal pressure during coughing, laughing, sneezing, the intra-abdominal pressure changes biomechanics. And also when we have a very heavy load, and it can be, it can come from, for example, pregnant uterus, or it can come from resistance training when we have very heavy load, or it can come from the heavy body which is related to obesity, for example. So when we have a very heavy load here, we still are changing the biomechanics of pelvic floor muscles, and you can see that maybe this muscle that should close, for example, urethra, for example, the anus, so they cannot work properly, and therefore it can happen that the mother is leaking, so she's losing some portion of urine coughing, sneezing, laughing, or jumping, or jogging, and it is very, very typical situation. So what we want to do is to teach them how to do the pre-contraction, so contracting the muscles like we would like to lift the pelvic floor and lift it and also pull it in, and close it in. So the support here is much stronger here, and the efficiency of the muscles to close the openings of pelvic floor is much, much more effective. So this is the Valsalva maneuver that we have here. We try to avoid this kind of intra-abdominal pressure increases. We try to teach them to properly breathe properly during each exercise, to do exhalation where the intra-abdominal pressure is increasing. So during the contraction of all the muscles, I should exhale to decrease intra-abdominal pressure, and also during the exhalation, I should do the contraction, the pre-contraction, so-called the neck, to lift all the structure and to have better control on urine or fecal continence. And here we have a nice animation. Let's go to this quickly.
Nowa Cupra Terramar zachwyca muskulaturą, zaskakuje przestrzenią.
Urinary incontinence is the inability to effectively control your bladder. This can lead to a decline in quality of life and limit enjoyment of activities and social interactions. Up to 75% of pregnant women will experience urinary incontinence as a result of the increased weight of the growing baby on the pelvic floor, as well as changes in hormones. Often, urinary incontinence persists after delivery and can continue to affect quality of life. We conducted a review of all available research to determine if prenatal exercise influenced urinary incontinence during and following pregnancy. We found that women who did pelvic floor muscle training, such as Kegels, had a 50% reduction in the odds of developing urinary incontinence during pregnancy. This type of exercise also decreased the severity of urinary incontinence symptoms. In order to get the greatest benefit from pelvic floor muscle training, we recommend getting instruction in proper technique from your local pelvic floor health specialist. For more information on exercise and pregnancy and the research we are doing, visit our website, www.exerciseandpregnancy.ca.
Okay, so short animation, but coming back to the presentation, I have also, let me go to the chat. Hello, I shared yesterday. Okay. Okay, so let's go to the presentation. And I need to reorganize. Okay, so these are the examples of questionnaires that I truly recommend you, because as it was stated on the animation that 75% suffer from some kind of urine leakage during pregnancy, and it is a typical situation but not physiological situation. So we try to help the mothers to avoid urine leakage, especially that it can affect their physical activity and social life. So they are ashamed, they limit their physical activity, they avoid running, or they plan their walking in terms of the access to toilets. They are not wearing the clothes they would like to because they are afraid that some spots from urine will be visible. So it's really, really annoying. And what we want to do, even if we cannot completely stop all these symptoms, we can for sure can improve their quality of life and to improve the control and to first of all explain why it's happening, that actually it's very typical and that we should fight against these situations and that exercises are very effective in this fight. So these are the examples for you to use for your patients, for your participants, for your clients. Simple questions. So the incontinence impact questionnaire, just 7 questions. And this is just the screening. So if you see too many responses like moderately, greatly, this is the first signal for you to signpost your client to better assessment for maybe physiotherapy, for some kind of stimulation, and maybe the exercises will not be sufficient. It doesn't mean that they should not be implemented. Always exercises should be implemented. Only in the situation when they feel pain during exercising, this is the only reason why they should not perform them. But even if the symptoms are very severe, they should exercise. Sometimes other medical treatment is necessary to help them to treat the conditions completely, but still it is always a part of the treatment. But for many smaller problems, exercise will be very helpful. So remember the name of the questionnaire. It's easy to calculate, but still the important information is that I chose that one because there are many versions of this questionnaire translated and validated for many languages, and I'm sure it is so for sure it's in Polish. We use it in Polish, but there are many language versions, so please check. I'm pretty sure that you have in your Spanish, Portuguese, and Lithuanian version as well. Another very popular one is International Consultation on Incontinence Questionnaire. Short form, I generally recommend using short forms, especially for pre-screening, because when you start working with your clients, so you have to ask many questions. So short forms are like 5, 6, 7 questions, and it's enough to say, okay, you have problems, so probably we have to deal with that, and maybe you will need more sophisticated diagnosis. So this is the website where you can find different versions of this questionnaire. And also, what I would like you to understand is that we can incorporate pelvic floor muscle exercises into general classes. Usually it is done at the end of the class as the cool down part, because usually when we do the so-called isolated exercises, so when the muscles of buttocks, thighs, abdominal muscles are relaxed and we are exercising only pelvic floor, so the intensity is decreasing substantially. So therefore we use the isolated pelvic floor at the end of the classes. But we can do marching, we can do jogging, we can do squatting, we can do push-ups using pelvic floor consciousness contraction, and we can have extra time, extra load for these muscles during general exercises as well. So these are the outcomes from our studies. I will not have time to explain all of the details from the study, but I just would like you to understand the methodology. We had these vaginal probes inserted into vagina by the woman herself, and then she was exercising with the electrode, and we could observe the graph, how she was contracting. So this is the graph for pelvic floor, 5 quick contractions, and then it was 5 10-second contractions, 60-second static hold, and also the baselines before and after, and the rest lines between the contractions. And this is the proper technique when we had the contraction of pelvic floor and the abdominal muscles and gluteus maximus muscles were relaxed. Sometimes we didn't have such good technique, so this is a good technique for the for this isolated exercise. And here is the example when you can see that this lady couldn't contract the pelvis. So it was something going on here, but she was actually contracting abdominal muscles instead. And for sure, she must have some extra training, usually with biofeedback, so she could observe the changes on the monitor. And I recommend you this kind of training. This is an example only of the exercise. So we try to have contractions which are very short, which are long, to increase speed, to increase the reactivity of the muscle, to increase strength, and also to increase the muscle endurance. So therefore, also longer static hold should be implemented. And we also have to have in mind that between the contractions, all people require rest of the muscles and consciousness relaxation before relaxations will be necessary for the time of giving birth. And also when you go to the toilet during micturition, so when you do pee or when you have defecation, so you should completely relax the muscles. And the same is during the process of laboring. So the higher level of relaxation, the lower level of pain during the labor and delivery. Okay, so this is what I want you to understand. Here you can find some papers that we published based on our studies. I will not go to the details, but generally I would like you to remember that even in HIIT, we could observe better relaxation of the muscles in the relaxation phase. So it's not true. Sometimes it was even one of the questions that when the mother is, for example, at the end of pregnancy, like 29, 28 or 30 weeks of gestation, she should stop exercising pelvic floor because she will be so tense, so tight, that she will not be able to give birth, and that the birth will be painful, that there will be more injuries because of that. So this is a very harmful myth. What we know that even if you have the training by the day of birth of the pelvic floor muscles, so you still can have better relaxation because it's again contraction, relaxation, contraction, relaxation. So you increase the level of your consciousness when the muscles work in which way. And for the end, I would like to say some myths. It is painful to do pelvic floor muscle exercise after giving birth. We have some studies that can confirm that it is not painful for most of them. You should not be afraid to start the exercises as quickly as possible. Also, there are some myths related to geisha balls, some equipment. Remember, equipment is just the equipment, so it is not harmful. It is not essential part of your training. So if you choose some equipment, it can be motivation for you. It can be, funny because it's colored, or you feel the feedback from the cones, but still it is not dangerous. There are so many myths and different opinions. So this is a confirmation that both trainings with and without equipment can be effective. Also, the applications, what we know, application itself is not necessary to have effects of the training, but it can be very helpful for the motivation for assessing the outcomes. So if you are enough motivated to do the exercises regularly, you don't need the application. But what we know, the reminding, the The games related to that can be funny and can stimulate motivation and improve the adherence. And actually, the regularity of performing exercises is the key condition to have better outcomes. So don't be worried, don't be afraid of the applications, but don't treat them as the key factor to observe effects and good results. And also another very, I can say, harmful myth is here about the PP stop exercise. So sometimes when we don't have a possibility to check this the condition of the muscles in physiotherapists and by some specialized equipment, you can use the PP stop exercise to stop the urine during micturition, and it will not be harmful for you. We treat it just an self-assessment from time to time. We don't have idea how many repetitions could be harmful, but the occasionally performed exercise from our studies, what we observe, it is not harmful, and actually we had beneficial outcomes after our training. So here I will give you some more information about our I can say recommendation. I don't have time to go through it now, but what I know that you have also some other classes related to the biomechanics and also some diastasis recti recommendation, and also this is about the contraindication changes. So actually I went through all this during my my presentation. Maybe that one I didn't maybe focus too much. No, it was gestational. So everything I think is covered. So maybe some nicer slide for you. And ending the class, I would like to suggest, maybe not suggest, but announce some activities that we are planning to have. So one session will be in Atlanta next Tuesday during ACSM conference. One will be held in Rimini in July, and also in October we are meeting with Rita. We are going to Professor Michel Motola, and we will have some kind of presentation there. And again, this is the website that I recommended you to use the materials. So I have to stop. I have, of course, much more materials to present, but I don't want to keep you longer and overcome the time too much. Can you please share your opinion for trying to contract muscles and stop urinating during peeing? Is there any good of that during pregnancy, postpartum? You mentioned how important it is to relax muscles during peeing in your slides. Also, actually, I responded to your question. So just to have some evidence-based approach for that it is not dangerous. I didn't find much, but still there is something that you can use to have some evidence-based approach. So for peeing and stopping it is, I was trying to look for some studies that can confirm or, dispel the myth. And it was only one study dealing with the problem. So we have no evidence so far that it's harmful. This study was assessing the problem. And in fact, it was a little bit higher amount of urine in which was kept after the stopped urination, but only in this one urination. So all other following that one were completely the same. So we cannot say that it can disturb the pattern of urination. So of course, when you stop it, maybe in that one, the small amount of urine will be left in the organ which is responsible for urination, but still it is not harmful for the next processes, and that's it. So it maybe will be helpful for you. Okay, any more questions?
Yeah, that's the same. I did question you this. So Should we like recommend as well to try to stop peeing from time to time just to assess themselves, the patients?
Yes,
Like
in my opinion,
science or just assessment?
yes, just for treating it as a self-assessment, not as an exercise. So we have no data about that. If it would be a problem if you go to the toilet and exercise, I don't know, 10 repetitions of that. We don't have data about this kind of exercise. I don't know if it's harmful or not. So therefore, I would not recommend it. What I know that for many years, I recommend my participants to do the self-assessment, for example, once a week, once every 2 weeks, and they do it. And we have very good outcomes in terms of improvement, in terms of urine leakage, and also in terms of their problems with pelvic pain. But it is, of course, a complex program. So everything is related to that, not only pelvic floor exercises, but also body posture, breathing. So we have a complex program and we have a very good outcomes, even if we recommend having this self-assessment for urine leakage during urination. Stop your urine to check if you can control your meds. And we recommend it for many years. So from that perspective.
Okay, thank you. Yes, that answers. I just from time to time still come face to face with like a myth. Like, okay, I train my muscles. I stop being once in a while, yeah, and just to see how it goes. And I'm lost sometimes. Like, I didn't dig into science literature regarding this, but it was in my mind. Like, is it actually like more of an assessment, or should we recommend as an exercise as well? But you answer that.
Okay, thank you. I think that for many women, it is very problematic to have an idea where the muscles are located, right? So this is the only way how they actually can check it. Because when we have the laboratory assessment, they are very happy that finally they could see in the screen how the activity is changing. But sometimes they don't have access to specialized equipment, and just go to the toilet is the only one way that they can check. So therefore, I would not be afraid of this kind of recommendation for them.
I can also share my experience if you're interested. Because I had 2 kids and I wanted to know more, how is it going in your body, what's changes, and what I should feel. I was living in Iceland and they had quite good physiotherapists who specialize in like women's health and prolapses and so on. So I went to see her, and what they did, I have of course to sign like that she can examine me with a gloves like gynecologist, and she checked how I am contracting the muscles, like a gynecologist chair, but a simple bench. And she just teaches me in a simple way, in a simple manner. She said you can just basically put your fingers into yourself and try to squeeze it, and you will feel like which side squeezes less or more. And it basically says, but you should try to encourage that side to press more. So I think we can advise as well. Maybe it's a bit harder when you are pregnant, but postpartum, it could be useful maybe.
Yes, you are right. So this is one of the recommendation. Yes, so please use your fingers into vagina and try the contraction. So this is one of the recommendation. But as you mentioned, for pregnant women, sometimes they are a little bit afraid of that there will be infections or something. They don't feel comfortable, and it is one way to check it. So sometimes they are not feeling comfortable with the finger applications, but still it is one of the way. I'm completely agree with you that it is one of the way to learn, to teach people, and also having the chance to go to the physiotherapist that will teach you. It is a very luxury situation, but still not all of these women have the chance to pay for that. It is not paid by our government, for example, so they have to pay extra money for such a visit, and not all gynecologists do it during the regular visit. So therefore, not our Polish women have the chance for that. Yes. So
okay. Thank you.
They can use the boyfriend or the
Yes,
husband as well.
yes, that's also
Much
nice.
more natural.
Yes, that's more natural, and this is also a very, very, recommended way. One of the ways, and it's nice when they are, both are cautious about the importance of this exercise, because it's not only for the women but also for the men. Yes, but still, I would not be worried about the PP stop exercise. So it's one of the possibility to check. But thank you very much, Milda, for sharing your opinions. Okay, so I guess that we are done, Rita, right?
Yeah.
Okay, so thank you very much. I will finish the class, and I wish you all the best, and enjoy the rest of the lectures, and also enjoy the stay in Portugal. So I really envy you that that you are going there and enjoy the class. So thank you, and bye-bye.
Thank you, Anna.